This space not only represents what is, it also helps us think about what can be. Discovery and innovation isn't a point in time. You don't get to completion on it. The way this space has been thought through, the different collaborative areas, the different environments for learning, it's going to push us in our organization to continually get better. My name is Matt Schaefer. I have the privilege of serving as President and CEO at East Tennessee Children's Hospital here in Knoxville, Tennessee. Children's hospitals are different. Children aren't just little adults, and they need specialists who know what pediatric healthcare looks like, what developmental milestones look like. We serve kids to make sure they stay well, and when there becomes an illness, how do we investigate as well as treat so that that illness is brought to completion and health is restored. The Discovery, Innovation, and Simulation Center is an important component of our care continuum. You don't see patients coming through this space. It's an environment for learning before patient care happens. It's an environment for learning after patient care happens. And in some cases, it's an environment for learning as families leave this facility and go home with their child to ensure they are equipped for success beyond their interaction with Children's Hospital. The next generation of teaching facilities, whether you're looking here at Children's Hospital or you're looking across the street at University of Tennessee, Knoxville, is around spaces where interactions can happen and creating environments where those interactions can feel natural. This space has lots of different places where you can come and learn and absorb. We have open collaborative space to push teams to be together. We have classroom space. We have simulation space for skills-based learning in the moment. We have family teaching space along with clinicians. And we have an R&D space where we can do things like 3D printing to be able to recreate something that we might not have thought about previously to care for patients and families. We should feel good about how the simulation space looks, primarily because we're a children's hospital. It's got color, it's got different zones. You walk into it, it's inviting. You want to be here. You're intrigued about what's in that next room. And I think that all works together to ensure that the space is useful, but the space in and itself produces some innovation in how can we use it to better what we're doing at the bedside. When you're thinking and imagining a collaborative space, you want to be able to have a collaborative partner think through what that space should look like, that pulls on expertise from other organizations, that pushes you, that allows you to push them. And that's what Barbara McMurray Architects represents for Children's Hospital in this creation. When there's a challenge that we're thinking about, that we're even thinking the next step towards, we haven't even committed funds toward it, I can pick up the phone and I can call the team at Barbara McMurray, and then not only immediately pick up that call, they'll start to think with me. They're going to help imagine what could be, not worrying about what's next in terms of scope of work. And they're ultimately going to produce an outcome like we've been talking about in the Discovery, Innovation, and Simulation Center that's beyond what we could have imagined at the beginning. And that's the type of relationship you want to have with any partner. And they have been a great partner, and I imagine they will continue to be a great partner for Children's Hospital.